Hello and welcome to Medical Mondays, the special. We're taking a look back at our big medical stories of 2025. Thanks for joining us. I'm Lisa Carberg. As the medical reporter here at News 8, I'm always diving into the cutting-edge research, technology, and healthcare here in Connecticut. Now, first up, we're introducing you to a Madison artist who loves what he does. He's so talented, many celebrities have hired him over the years, but a persistent pain in his painting shoulder and arm threatened to end his career until he found a certain spine specialist.
Patrick Canino is in his element in his studio in Madison. He once had an office job, but took the brave step of becoming a full-time artist 26 years ago and hasn't looked back.
I live a life of creativity. You gotta wake up every day excited to create something out of nothing. It's a very positive career.
One opportunity of painting faux wall work for Judge Judy led to recommendations to other stars for paintings.
Patrick did a great job on this picture. I've never seen anything like it. It was really scary.
And murals, lots of them, for Post Malone. Sylvester Stallone for his Rocky mural in Philadelphia.
You are doing an absolutely brilliant job. I think it's better than the original. I can't wait to see it in person.
Athlete Dennis Rodman, the late wrestler Hulk Hogan, and actor Chevy Chase. He really loves huge murals like this one in Middletown.
A lot of it is contorting my body, right? So you're putting your body in odd areas.
But being on scaffolds and in bucket trucks to intensely paint took its toll.
Something happened, and all of a sudden this pain from the shoulder dropped down to the tricep, then to the forearm, and then my hand went numb.
He was diagnosed with 2 herniated discs. Physical therapy didn't work.
So obviously that's my life, that's my career. This arm right here is imperative to me. So it's super important to have Dr. Yu, look at it and fix it essentially.
Enter Hartford Healthcare spine surgeon James Yu and his artificial disc replacement device. Patrick painted him on the day of our interview. He explains what happens when a disc becomes herniated.
Sometimes it can kind of come out. And when it comes out, it presses on a nerve, and it can either chemically irritate it, or it can actually cause a compressive problem, or both.
That leads to an intense burning pain in the arm, and it was Patrick's painting arm. Dr. Yu shared these MRIs. Here, the spinal column is smooth, but here, the herniated discs are out of alignment, causing pressure. Dr. Yu replaced Patrick's discs with 2 of these ceramic devices called Simplify, going in through the front of his neck.
What I have in my hand right now is made of a ceramic material, so it's MRI compatible, as opposed to, say, previous versions of disc replacements, which were more metallic.
Recovery was brief, and Patrick got right back to work. He had committed to this Hamptons event with Chevy Chase and Christy Brinkley, painting this that night for free and having it auctioned off for an animal charity. Dr. Yu was even there to see his patient.
All the people you make happy in the world.
Patrick can't believe his new lease on life and career.
I thought I'd have a little bit of pain in my shoulder the rest of my life, and I was okay with that. So the fact that I have no pain now is incredible.
Now, most people are candidates for this type of disc replacement, but Dr. Yu says that people with arthritis or soft bones probably would not be. Now, the discs can be used in the spine as well, and since they are made with a material, including ceramic, as Dr. Yu said, they can take MRI images, which they couldn't with previous discs. Now to a new technique that patients with enlarged prostates say have solved their issues. It involves a high-tech pressure water system. Take a look.
Joseph Baddeley loves golf, but prostate issues impacted his life around the clock.
Didn't sleep very well, and I let it go on and on for a while because I'm not one to run to the doctors for a Band-Aid.
How are you feeling?
Great.
How'd you do after the surgery?
Fantastic.
Joseph finally sought relief from Trinity Health urologist Abe D'Amato.
As men age, one of the natural processes is the prostate can grow, compressing the tube that we pee through like an elephant stepping on a garden hose.
Dr. D'Amato uses these images to show patients a new treatment called aqua ablation. A powerful water jet clears a path.
Removing the tissue in the middle is like pulling the cork out of a wine bottle. You're left with a nice big tube for the urine to pass through.
Joseph says it was a piece of cake and loves his results.
Everything functions normal, just like it should, like when I was a younger guy.
Dr. D'Amato says aqua ablation uses ultrasound guidance for precision.
so that it knows where we want the jet, how powerful to make it, at what given point in the procedure.
And many men worry about side effects of a procedure, whether they will or still have urinary or sexual function. Dr. D'Amato points out that one of the advantages of aqua ablation is that it avoids other structures in the body, making for a very small risk. Right now, it's only done in a few locations in Connecticut. Turning now to the recovery after a stroke. It can be challenging and difficult for everyone, leaving one Madison woman unable to speak at first. Therapy at Gaylord Specialty Healthcare gave her speech again, and now she pays that forward as a volunteer helping other patients there.
Relax your heart.
Paula Gallagher is performing something called Reiki on Kara. It's an alternative Japanese therapy for relaxation and wellness that involves a force of energy.
You see like lots of colors that you can just like calm your mind and your space, and it like detaches you from all of, you know, the noise that is here and what has happened and whatnot.
Kara was bucked off a horse but is lucky. She can walk and will go home soon. Treatments like this are helping her through her ordeal. It's part of Gaylord's approach to healing patients both physically and mentally.
Imagine you're taking healing energy into your spine and the whole body.
It's an integrative medicine program.
And we have massage, mindfulness, meditation, stress relief techniques.
5 years ago, it was Paula who needed Gaylord's help after suffering a stroke.
I didn't have any physical deformities, but I couldn't talk and I couldn't write. Find my way.
Paula started her journey of extensive speech therapy. Hours of hard work and determination to speak has paid off.
New growth, hopeful.
When we first met, she was speaking in single words. We were able to progress to short phrases and then eventually meaningful conversations.
Paula now wants to tell people to be patient with stroke survivors. She's thrilled to be able to communicate again and now give back volunteering.
Gaylord gave me my life back again, you know, and I feel at home here.
Now to a story of a Clinton man playing tennis at a high level for 50 years when an injury sidelined him. But after hearing about the sports medicine doctors at UConn Health, he's competing again, this time in a new sport.
60-year-old Jeff Morse has no problem playing pickleball at a very advanced level, even though he's older than his opponents' ages combined. In 2018, healthy Jeff wiped out while running.
On the second step, my right knee literally appears over there, and I hit the ground, lights went out, I hit my head, and I think 60 seconds later I heard ambulances.
Jeff learned his ACL had been torn for years, and he pulled ligaments. So UConn orthopedic surgeon Robert Arciero shows what he replaced in Jeff's knee with grafts from his body and donors.
This is part of the ligament that he tore, and this is called the lateral collateral ligament.
Dr. Arciero explains what it does for the knee.
Those three ligaments control this, the knee from doing this, okay, and spinning. Very, very important if you're a pivoting athlete, right?
The surgical team was amazing. They took a graft from my hamstring and they twisted it, so it's double the normal size. And then they run a blood supply to it.
While Jeff was rehabbing, his good friend Oliver Bausch suffered a stroke and could no longer play tennis, just pickleball. So Jeff switched sports with him and hasn't looked back. He has now won pickleball U.S. Nationals in singles and doubles.
I don't think about it at all. I can stop, start. I have more confidence on the right-hand side, which is the side that I had to work on, than I even have on the left.
It's amazing playing against Jeff because he's so fast for his age, and the fact that he essentially got his entire knee replaced, you would never understand. It's almost like he's got a bionic knee.
It's the hardest player I've ever played against, yeah.
There we go.
Hits it so hard I have to be back at least, 10 feet to try to return it.
Grandpa!
Love it. And Dr. Arciero says whether it's college athletes or athletic adults like Jeff, getting them back to doing what they love is the rewarding part of his job at UConn Health. Still ahead, a rise in cancer in young people, what doctors say could be driving the increase. plus failure to progress. Medical professionals raising concern over the number of C-sections being performed on women.
Amber and Zach Jones spent 14 years making a life here in Connecticut. Zach, a rising research star at ESPN. Their young son Silas adding to their joy, sharing a love of family, togetherness, and baseball.
I could do so many different things with him. Our front yard was a football, soccer, baseball, wiffle ball field.
Their family life seemed perfect, but in 2022, their journey took an unexpected turn.
He had some stomach pains and he thought it was almost like gas.
At just 39, Zach and his family were not prepared for the shocking diagnosis that would come, stage 4 cancer that had spread from his colon to his liver. For the next 2 years, their lives revolved around surgeries and chemotherapies.
He wanted to do everything he could. One thing that he told me was, I want to make sure that Silas knows that I did everything possible to be here.
But by the fall of 2024, Zach was too sick to continue treatments, passing away 3 days before Christmas. He was just 41. While heartbreaking, Zach's story is becoming more common, part of a growing trend of cancer in young people.
They have been appearing largely within breast cancer, colorectal cancer, gastric cancer.
A trend concerning enough that Yale created a new early onset cancer program at Smilow Cancer Hospital. Dr. Nancy Borstelman and Dr. Vita Geary are co-directors.
It's going to take a lot of us putting our heads together to really, make some advances in understanding this.
Research out of Columbia finding a geographical component when it comes to breast cancer specifically. That study shows Connecticut is one of 5 states with the highest rates of breast cancer in women under 40. It found 41 cases per 100,000 people in our state. Something Stonington mother and wife Megan Schroeder dealt with firsthand, finding a lump in her breast at just 28, but she was not diagnosed until 30 after giving birth to her son Tatum.
When you go into the doctor's offices and you're the youngest one there, or nobody in your friend group, or you went to college with, or high school is really getting diagnosed with breast cancer, felt very isolating.
With no family history, Megan, like so many others, wonder why.
I just remember being so optimistic and cheerful going into the appointments. There's no way, I'm too young.
Pay attention to how you feel. And even if others are saying, oh, don't worry about it, take that concern and bring it to a doctor.
Now, Megan is considered cancer-free, but will remain on medication for the next 5 to 10 years. The doctors you just heard from are studying lifestyle factors as well as several others. They're trying to figure out exactly what is driving this trend and to offer patients ways to lower their risk. Take a look.
It's actually been alarming because it has been showing up across a number of cancer populations.
Dr. Nancy Borstelman is part of Yale's newly formed Early Onset Cancer Program. It's aimed at treating cancers in young adults and determining what is causing them.
The why is a critical question, and it's being researched by many across the nation, across the globe.
That research includes digging into factors like genetics, environmental, and lifestyle.
We know that there are a lot of toxins, but how much is this increasing your risk of getting breast cancer? So doing the best you can at, using more natural beauty products, natural whole foods.
Stonington wife and mom Megan Schroeder is reevaluating her lifestyle choices after being diagnosed with breast cancer at just 30.
I'm more aware now. I definitely was, I would say 50%. I've paid attention to the fruits and vegetables and different things like that, but cosmetics and beauty products, I didn't really pay attention to, what are the chemicals that they're putting in fragrance or, the deodorant I'm using. I just used whichever one works.
If you're unsure what is in your beauty products and foods, there are a number of free apps that can help. Just scan your item for a breakdown of ingredients.
Every little thing that can increase your risk, try to get it out.
Some of the biggest risk factors: tobacco, obesity, and drinking. Just this year, the U.S. Surgeon General issued a 22-page advisory warning of a link between alcohol use and cancer. According to that advisory, more than 741,000 cancer cases worldwide were attributed to alcohol consumption in 2020. Dr. Borstelman says it's important to take a look at your lifestyle as a whole.
Is it something that is inherent in me, something about my genetics? Is it my lifestyle? Is it the way that perhaps I've gained weight? Am I sedentary? Is it something about physical activity? Could it be use of alcohol or smoking? Some of these other ways.
And remember, you can do everything right and still face a devastating diagnosis.
Sometimes things go awry, even in ways that you don't expect. So could be somebody who's lived what it seems like, very healthy, done all the right things, so to speak.
Now, one of the biggest takeaways as we covered this story, cancer in young people, was to know your body. Experts say advocating for yourself and speaking up if something feels wrong can make all the difference. And there are some potentially life-saving things to look out for.
This is a real increase.
Concerning statistics have doctors like oncologist Eric Weiner working to figure out what is driving the trend of more young people being diagnosed with early onset cancers, specifically colorectal and breast.
It's hard not to believe that it's something related to the environment as a whole. And when I talk about the environment, I'm talking about what we eat, what we breathe, what we come in contact with, everything.
Diagnosis and treatment can be especially tricky for an age group that does not fall under screening recommendations. For those without a family history, current guidelines recommend colorectal screenings beginning at age 45 and mammograms beginning at 40.
Although we typically haven't screened younger people, that there may be some younger people who need screening, and we have to do research to figure out who those people are.
Dr. Weiner says knowing your family history, and more importantly, your body, is key.
It's important for a young woman, if she's really concerned about something in her breast, to push and make sure that she gets the kind of evaluation that she needs.
Stonington wife and mother Megan Schroeder knows what it means to advocate for yourself as a patient. After feeling her first lump at just 28, it took years to ultimately get a breast cancer diagnosis.
Even the slightest symptom, aching, fatigue, or even if it is a small lump, maybe look further into it or get that second opinion.
Too often, doctors and others tend to, this may be a little harsh, but ignore findings in younger women and assume that they're just related to some benign etiology.
Now, Megan is paying closer attention to her body and what goes in it.
I've paid attention to the fruits and vegetables and different things like that, but cosmetics and beauty products, I didn't really pay attention to, what are the chemicals that they're putting in fragrance or, the deodorant I'm using. I just used whichever one works.
Some good advice there from someone who has gone through a cancer diagnosis herself. Still ahead, rates of cesarean sections have risen significantly over the past few decades, despite warnings from major health organizations. We're diving into what is driving this trend. Welcome back. The rate of cesarean sections, babies born via surgical incision to the mother's lower abdomen, are on the rise, jumping nearly 60% since the late 90s. That's despite significant concerns from the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine. That's the procedure is overused.
It's a moment a woman often dreams about her whole life, meeting her baby for the first time. But for 1/3 of women, labor and delivery turns into unexpected surgery.
They were like, yeah, you're gonna have to do the C-section, I'm sorry.
Cesarean sections are the most commonly performed surgeries in the country. More than 1 million moms every year wheeled into operating rooms, secured to the table, and cut open.
There's so much a blur.
Certainly if it's an emergency and it's a life-saving surgery that's needed at times, but we're overusing it.
Michelle Telfer is a certified nurse midwife who has been delivering babies for 23 years and has witnessed the jump.
It's gone up probably from 20% when I first started practicing to, in many places, 35%. In some parts of the country, it's up to 50%.
In 2022, just over 35% of births in Connecticut were via C-section, the fourth highest rate in the country and the highest of all the Northeast. The risks: damage to other organs and a higher potential for blood loss. Allison O'Brien knows all about the procedure and its recovery. Her first baby was born via C-section when doctors decided her labor wasn't progressing.
The doctor checked and she said, okay, well, you've been at 6 centimeters for a while now, and I'm going to come back in an hour, and if nothing has changed, we're going to do a C-section, and that's exactly what happened.
The reason for Allison's C-section, cited as failure to progress.
I think a lot of times it's really a failure to be patient. It is completely up to you and your preferences.
Hamden doula Ashley Minahan teaches childbirth classes and works with expectant mothers, frustrated seeing what she calls unnecessary C-sections for women.
You can say yes or no.
Who could continue laboring.
As long as everybody is safe and the baby's stable, they should be able to keep going.
Ashley worked with Allison on her second birth at a different hospital with a different provider. While her labor was similar, the outcome very different. A successful vaginal birth after C-section, known as a VBAC.
The things that my body did in both situations were similar, but the support I had was very different.
Rates of C-sections vary widely depending on the doctor and the hospital.
Some providers are a little bit more used to doing surgical births. You can do a C-section in an hour, but somebody can be in labor and have a vaginal birth after 24 hours. And so a cesarean birth is certainly much quicker.
And much costlier. Yale New Haven's price estimator puts a vaginal birth without insurance at just over $24,000. A cesarean, more than $33,000, nearly $10,000 more expensive. Yale doctor Audrey Merriam says cost is not a factor.
That is definitely not weighing to the provider's mind, and I would say it's not even weighing to the hospital's mind, because from a hospital standpoint, they again are looking to do what's safest for mom and for baby.
Something that is on the minds of the healthcare providers we spoke to: lawsuits.
Malpractice is definitely something that's talked about a lot in obstetrics because our rates are pretty high.
You never get sued for doing the cesarean. You'll get sued for not doing it.
At the end of the day, in this case, a little one's birthday. Everybody agrees the goal is the same.
Try to take it on a case-by-case basis and say what's best for this mom and this baby in this instant.
Now, expectant moms can reach out to their provider and request rates of vaginal deliveries and C-sections, but it's important to note high-risk practices in hospitals will have higher rates because of those patient populations. A new app is helping people see a doctor anytime, anywhere. We'll tell you how it works. And we're going inside the kitchen at Griffin Hospital for a look at how their executive chef promotes heart-healthy living and recipes. Parents who have children with chronic conditions, rushing to the hospital and being a patient can be a way of life. Connecticut Children's now has a home health care agency that is giving children hospital-level care, allowing them to stay right in their home with their family. It has changed the life of one Monroe family.
How have you been? I haven't seen you in 3 months. And you got so big, my dear.
Nurse and case manager Samantha Murphy Plaskin checks 8-year-old Noelle's vital signs. She is from All Point Home Care, a home health agency owned by Connecticut Children's.
And to me, this work is about helping each child find comfort, dignity, and joy while supporting their family every step of the way.
Noelle started having seizures as a baby and was eventually diagnosed with Lennox-Gastaut syndrome, a rare and severe form of epilepsy. She's nonverbal, non-mobile, and has breathing issues. It affects 1 or 2 children out of every million. To her parents and younger siblings, she's just one of them.
We don't leave her out of anything. She is included in every part of our lives, and so I think that's made a difference. Are you making faces at me?
Christine Wilkinson is one of Noelle's main nurses. Noelle's room is equipped like a hospital room with a lift, lots of medical equipment, and medication to treat her seizures and help her breathing.
At least I'm getting smiles out of you today.
Her high-level care
It was a little thing when I started with you.
helps keep Noelle away from any germs she could face in a hospital.
Bathe her, wash her, brush her teeth. I would administer her medications, her food, and then I would monitor her throughout the day for any changes in her status.
Before finding all-point home care, their life was challenging.
A couple times a month, at least, calling 911, and you know, it was our life, just middle of the night emergencies. My parents at the time were critical part of our picture, and so we would just sort of take turns and stay up throughout the night with her and monitor her.
Reaching out to the agency was life-changing for everyone.
I'll never forget the first phone call I had with Dawn, who said that they can help us, and they have. So it's been a huge blessing.
Technology is making it easier than ever to get the right medical care. Seeing a doctor or nurse can happen any time of the day or night virtually. Here's a look at some new 24/7 apps up and running.
There's no one who's using your app who can gain entry into your medical record.
Healthcare at your fingertips anytime you need it.
Immediately connects you to verifying your identity.
Dr. Padmanabhan Prem Kumar shows us the HHC 24/7 app from Hartford Healthcare.
You download the app, put in some basic information, authenticates who you are, tell us what medical condition you're looking for.
You don't have to be one of their patients to access care.
As you can see, I'm logged in. We have care available, as I mentioned to you, 5 to 15 minutes from now.
Yale New Haven Health also provides round-the-clock medical care through their 24/7 virtual care. Patients can see healthcare providers virtually for many conditions, says the medical director of Digital Patient Experience and Virtual Care, Dr. Robert Stavert.
Minor illnesses, colds, flu, where maybe people don't want to go into a clinical setting if they can avoid it.
Patients are typically connected with a doctor quickly. Appointments are also available. Virtual visits are proving to be a positive trend.
There's been a lot of excellent, rigorous data and studies demonstrating the safety and quality, the patient satisfaction of different telehealth modalities.
And a healthcare provider may advise more care.
Or if you feel like you need something a bit more sophisticated, we can get you to one of our care locations across the state just because we're located everywhere within the state of Connecticut.
Now to staying healthy while eating food that is still tasty. I went to Griffin Health's Healthy Kitchen in Oxford to learn some new recipes.
Now I just get a nice dice.
Executive Chef Daryl Murphy is sharing the simple steps to healthier eating with his class in his element at Griffin Health's Healthy Kitchen in Oxford.
Savor the flavor.
The goal for attendees here is simple.
Promote healthy eating, healthy nutrition, and try to educate them on how they can do that and fight chronic disease without having to take so much medicine.
The recipes call for healthy ingredients with herbs and spices, no butter.
We're gonna add our turmeric. Eating healthy has this stigma of it's not gonna taste good, or it's gonna be dry, or it's gonna be flavorless, and that's not the case at all.
A registered dietitian also advises the class about things such as
going to local places like the farmer's market or farm shares. I think it could be helpful.
So we're gonna go in on a bias.
And it's not just what they learned here in the class. Everyone gets this recipe card. Some people take it home and make that recipe the same night.
Hack at it with the knife.
It's an introduction to new ways of cooking that probably different spices and things that I haven't used before.
With Indian cuisine, it can get very, very spicy.
I kind of depend on it because I'd like to learn how to eat correctly. I eat what I grew up on, which is all pasta and stuff that's bad for me.
The classes are free and open to the public. Each has a food theme for certain medical conditions, but they all touch on the basics of making food that is healthy and easy, and tasty, as I can tell you firsthand. Preparing and cooking food for health.
Coming up next, we'll tell you how healthcare workers and advocates are destigmatizing the conversation around menopause. Welcome back. Now to a topic long considered too taboo to even talk about. Menopause used to be called the change, but it turns out there is a phrase before called perimenopause, and some women in their 30s and 40s can experience it even without knowing what's happening.
Hi everybody, it's Wendy Chin Tanner, your friendly neighborhood perimenopausal author friend.
It's something that impacts over 1 million women every year.
Vertigo, heart palpitations, elevated cholesterol.
Even celebrities aren't immune.
Guess what? It got me. And it got me bad.
Menopause is hell.
It is.
Some men don't really understand it.
What is menopause?
And sometimes even doctors have a hard time diagnosing it.
Lack of education in medical school programs is entirely systemic and institutional, as well as lack of clinical studies.
Menopause, which begins with perimenopause, when a woman's body produces less hormones and periods become irregular. It can start as early as the mid-30s or as late as a woman's 50s and last years with a long list of life-altering symptoms: hot flashes, skin dryness, trouble sleeping, fatigue, anger, depression, painful sex, and even brain fog. Meet author, wife, and mother of two, Wendy Chin Tanner.
I started to have cognitive issues with focus and with memory, fits of rage that were just seemingly from nowhere.
In her early 40s, those symptoms ruled her home, work, and sex life. The first of several doctors she sought answers from sent her to a cardiologist. Her heart was fine.
But she also didn't recognize that these were perimenopause symptoms because we have an education problem in terms of menopause and perimenopause care in the medical schools.
It took 18 months and 5 doctors to finally get diagnosed with perimenopause.
Good morning. Wendy Chin Tanner here.
So Wendy took to social media to educate other younger women about what could be happening to them.
Women are just saying, oh my God, me too, me too.
Some women don't say anything, so I think this is a topic that we need to discuss more.
Dr. Elisa Gerard is an OBGYN in Groton who tries to help her patients realize they may be going through perimenopause. And she may be the exception. Many doctors report having little training on the subject. A 2022 study finding only 31% said they had menopause curriculum during residency. The good news, Dr. Gerard says, there are now more ways to treat the symptoms than ever.
Hormone therapy is individualized. It comes in different forms.
Dr. Gerard says the benefits outweigh the risks often, including treatment like IUDs and birth control pills, which replace the hormones a woman is losing in perimenopause.
It's a small T-shaped device.
There are also non-hormonal options and antidepressants to manage mood swings and depression. Dr. Gerard sees amazing results.
It's like a miracle.
Still, research shows only about 5% of women seek out treatment. That's where Wendy comes back in.
Systemic and institutional. We should be able to go out there and conquer perimenopause and menopause just like we have with so many other things.
Now to a medical challenge many women face in their lifetimes: endometriosis, one that many women suffer with symptoms and without a diagnosis.
29-year-old Caroline Haney is a researcher at Jackson Laboratories in Farmington. For years, she didn't know what was wrong with her.
I would often miss school. I used to be really tired all the time. I didn't really hear about endometriosis until I got to college, which is crazy now looking back at things.
Now she's part of a research team working on endometriosis, which affects about 12% of women in their childbearing years.
It's been historically underfunded and under-researched, and here at JAX we are trying to tackle this, to try to understand endometriosis better.
Endometriosis is tissue resembling the uterus's endometrium that grows outside of the uterus, on the ovaries, fallopian tubes, and intestines or other pelvic organs. It can cause pain and infertility. Jackson Laboratories studies donated tissue samples from neighboring Yukon Health. They have tied endometriosis to the body's immune system.
We have ways to manage the symptoms medically. We have ways to remove some of those lesions surgically. But there is still a lot that we don't understand.
The research here gives Caroline true fulfillment in her career in hopes of helping others and herself.
Having a passion behind it and having a motivation really helps. It makes me enjoy coming into work every day.
Up next, a 31-year-old new mom finds out she has breast cancer while breastfeeding. Coming up, I'll show you her treatment journey filled with friends and smiles and a local foundation supporting key research. Welcome back. These next stories are about breast cancer. First up, meet a young mom who had just given birth when an unrelated screening led to her diagnosis.
I needed some cysts checked out with an ultrasound, and then a mammogram was done the same day, and then I had a biopsy 3 days later, and then I found out the results 3 days later. What do we see over there?
And just like that, 31-year-old Amber Steady of Waterford became a breast cancer patient.
The first thought in my head was, oh my God, I'm gonna die. And I was staring at my 7-8-month-old son.
And it was that little boy that may have saved Amber's life, breastfeeding Teddy when she felt something wasn't right, sending her to the doctor.
And I actually thought that I had a clogged milk duct, when in actuality it was a tumor, and just the whole left breast was completely cancerous.
As she documented her journey, something stood out. You can see it in her pictures. Amber's amazing spirit and attitude. Her mother-in-law says it was inspiring.
She is amazing. Never complained, had chemo, double mastectomy, radiation, and just always smiling, accepted help.
Today I have completed this phase in my journey. I ring this chime to celebrate the moment and to send a message of hope to all of those around me.
The treatment's finally over. Amber found the Terry Broder Breast Cancer Foundation, advocating awareness and raising money for breast cancer research through a popular Shoreline annual walk.
100% of all donations go to breast cancer research exclusively.
And that research is what attracts supporters like Debbie Yother.
My girlfriend actually was diagnosed 10 years ago, and at the time there were no treatments for her that would extend things. She obviously did get into remission, but then was re-diagnosed 2 years ago.
Amber is now a healthy mom to 2-year-old Teddy, and life is good. Whether it is a nonprofit advocacy group or elsewhere, Amber wants other women to lean on some sort of support system through their journey.
I had friends and family come with me to all of my appointments that I needed to, because having that extra support at doctor's appointments when you can't remember anything is very important.
Now, many survivors will tell you getting screened can save lives, but getting a mammogram for the first time can be tricky for many women. Here's the story of one woman who found it confusing. She almost skipped it.
Life is good for News 8 executive producer Stacey Antonini, a wife and mother to a beautiful little boy. She values health and always gets her recommended checkups. When she turned 40, her primary care doctor told her it was time for her first mammogram and that she would find the order in her MyChart.
It kind of looked like a prescription or something, so I didn't know what to do. So I didn't do anything.
Months later, her OBGYN mentioned putting in a mammogram order, and she could choose her own imaging facility. Stacey, who was used to figuring things out, knew nothing about imaging facilities. First, she was put on hold for a long time trying to schedule a mammogram, then told her order needed to be picked up and faxed to another location. Stacey couldn't believe how little guidance was given to get this possibly life-saving test for the first time.
I can see why any woman who's busier than me or has more responsibilities than me or more kids than me would just at this point say, forget about it.
Stacey kept working to figure out where to go and eventually had a healthy first mammogram.
It didn't hurt or anything like that, and it was quick. It was 15 minutes. In and out. So that whole part was the light at the end of the tunnel.
Her advice to women turning 40 and getting their first mammograms: ask for help and see where mammography centers near you are located. Also, ask friends and relatives. As Middlesex Health breast surgeon Catricia McWhite explains, that first mammogram is very important.
It really is crucial. It's going to set you up for comparison on a yearly basis
What we're looking for on the mammogram each year is some change from the prior year.
She urges women not to put off getting screened and letting time go by.
Catching a breast cancer early can mean the difference between a cure, which we expect to see in more than 95% of patients with stage 0 or stage 1 disease.
And that first mammogram at age 40 is for women who do not have risk factors like a family history. Talk to your doctor about when to start and ask specific questions while you are in the office. Mammogram orders can be taken to a hospital or an imaging center, and the costs are covered by law. You can always ask ahead. And we know breast cancer can take a physical toll on patients, and something like losing your hair is part of the process, but not for everyone. Now let's take a look at how a cold cap option helps preserve hair in women and preserve their confidence.
1 year ago, Michelle Collier was feeling great, coming off a cruise with her husband after retiring at 60. And like every year, it was time for her breast imaging.
I was able to go for the ultrasound because the mammogram machinery needed replacement parts.
Her ultrasound tech urged her to return for that mammogram, which she did 1 week later.
And then all of a sudden another person enters the room, and it's the radiologist who says, we're going to go to biopsy.
That's when Michelle's breast cancer fight began at Yale New Haven Health's Milo Cancer Hospital in Waterford. Michelle had stage 1 triple negative cancer in 2 small areas. Genetic testing also revealed she had the BRCA gene. As her treatments began, her support system formed quickly, talking, learning, and getting advice. As for surgery, Michelle didn't want to get breast implants. Instead, she chose the deep flap procedure where a woman's own tummy fat is used to reconstruct the breasts.
Going with your own breast tissue just is a one and done, and it saves you from radiation. So that was the binding story I was hearing from breast cancer survivors. There's a gel in here.
Michelle also learned something that is called a Paxman cold cap system.
Goes over the surgical cap.
Was available for free at Smilo in Waterford through a grant. It works to freeze the scalp to protect hair follicles from the chemotherapy drug.
So this goes on top.
It made treatment days last longer.
And make sure there are no air gaps.
But the payoff was more than worth the cold.
The next step is to plug me in.
To keep most of her hair.
It's not just vanity. It's not just young people who want to preserve their hair. It's everybody of all ages. We all care about our, not wanting to look sick. And that's important.
Michelle's hair isn't as thick as it used to be, but having control of part of her treatment and appearance was very important through the cold cap. She was even able to be in an American Cancer Society Beauty to Courage pageant, looking stunning in red alongside other women facing similar cancer battles. Dr. Robert Legary heads up this hospital and cites very positive trends since the height of the breast cancer mortality in 1989.
There's been about a 44% decrease in mortality for breast cancer from the last year that we have data for, which is 2022.
And Dr. Legary credits better breast screenings and therapies for breast cancer for fewer number of deaths. After the break, a little boy is thriving thanks to a special team of doctors at Yale, how a program is helping him beyond his hospital stay. For babies and their families who got their start in the NICU, adjusting to life at home can be an added challenge. And medical questions and concerns can follow for years. That's why Yale's NICU graduate program helps families navigate life after the NICU all the way through kindergarten.
What's your favorite sport that you do?
Jiu-jitsu.
Okay,
Meet Roman, now a wiggly, silly 5-year-old who loves sports and kindergarten.
What's your favorite special?
Library.
You'd never know. His start in life was so scary.
Quite the detour from what we, would have expected.
First few weeks were pretty traumatic.
Born at 23 weeks and 5 days, Roman weighed just 1 pound and 9 ounces.
We were kind of just, given all of the what ifs. And so every day was touch and go to start with.
With the support of the NICU team at Yale, little Roman got stronger every day, ultimately heading home after 4 months in the hospital.
By the end of the, 3 or 4 months that he was there, He made such a turnaround.
But Roman's journey didn't end there. Thanks to the Yale NICU graduate program, the medical and emotional support continues for families like Roman's long beyond their time in the hospital.
Just because you're discharged from the hospital doesn't mean his journey is over. There was a lot of appointments with specialists, physical therapists, occupational therapists, his neonatologist.
I think pretty uniformly families appreciate that when they're discharged from the NICU, they're not just sent off to navigate all of this on their own, and so that there's this soft place for them to land that can continue to help them navigate this next phase of their journey.
The program follows patients for years, helping families navigate any challenges that come up, making sure the graduate is meeting milestones, and most importantly, helping them feel less alone.
The needs change over time. A lot of their medical problems have resolved, but there's a lot of ongoing concerns for developmental and sometimes even behavioral concerns, and we can help those families navigate what that might look like in preschool and what that looks like as they're ready to start kindergarten.
A special bond between those who start as the littlest of patients and the caregivers who save their lives.
My biggest takeaway is how resilient they are and how much they grow and change over time and how much they surprise us, right? Many of these babies have very scary NICU courses. These families are getting lots of difficult news about the difficult medical complexities that these infants are facing, and then we watch them in grad and we get to watch them thrive over time.
I don't think we could have done it without everyone that, helped us along.
And in these situations, it's kind of like an all hands on deck.
And you can see more stories like these every Monday at 5 and 11. Thanks for joining us. I'm Lisa Carberg.